Early signs that cancer is growing in your body. Do you know what to look for? Is your body sending you warning signals about cancer that you're overlooking? What are the subtle signs that might indicate cancer is developing, and why are they so easy to miss? Cancer impacts millions globally, yet its early signs are often misunderstood or overlooked. Recognizing these signs isn't just about detection, it's about early intervention, which can significantly impact outcomes. Today, we're diving into this important topic, the early signs of cancer. Today, people are living longer than ever after a cancer diagnosis due to improved cancer screenings. Routine screenings catch diseases earlier when they are more straightforward to treat. Early detection can lead to better outcomes in a cancer diagnosis. You should talk to your doctor about any symptom that is new to you or has not changed, says Anthony Perra, MD, intake physician at City of Hope Atlanta. Early detection can make a huge difference, so it's crucial to be aware of these symptoms. Let's get started. Sign 1. Unexplained weight loss. The first sign to look out for is unexplained weight loss. If you're losing weight without changing your diet or exercise routine, it could be a red flag. This is often one of the first noticeable signs of several types of cancer, especially cancers of the pancreas, stomach, esophagus, or lung. According to the American Cancer Society, ACS, many people unexpectedly lose 10 pounds or more prior to their cancer diagnosis. Cancer cells consume a lot of the body's energy supply, and they may also cause changes in the way the body uses food energy. If you notice significant weight loss without trying, it's a good idea to consult with your doctor. They can run tests to determine the cause and help you address the issue. Sign 2. Fatigue. Next up is fatigue. We all get tired, but cancer-related fatigue is persistent and doesn't improve with rest. If you're constantly exhausted for no clear reason, it's worth getting checked out. Imagine feeling drained all day, every day, even after a full night's sleep. This type of fatigue can be overwhelming and interfere with your daily activities. This kind of fatigue can be caused by cancers that affect the blood, like leukemia, or by those that cause internal bleeding, such as colon cancer, which can lead to anemia and, consequently, severe fatigue. Persistent, unexplained fatigue is something you shouldn't ignore. It's important to speak with a healthcare provider to identify the underlying cause. Sign 3. Skin changes. Keep an eye on your skin. Changes like new growths, sores that don't heal, or changes in existing moles could be signs of skin cancer. Also, darkened, yellowish, or reddened skin can be symptoms of internal cancers. Pay attention to any new spots on your skin, changes in the color or size of moles, and sores that don't heal. Skin cancers can present themselves in many ways, so it's crucial to monitor your skin regularly. If you notice any unusual skin changes, make an appointment with a dermatologist. They can perform a thorough examination and, if necessary, a biopsy to determine if the changes are cancerous. Sign 4. Persistent cough or hoarseness. A persistent cough or hoarseness that lasts more than a few weeks could be a sign of lung or throat cancer. If you're not recovering, it's important to get it checked out. We all get occasional coughs or sore throats, especially during cold and flu season. However, if a cough persists for more than 3 weeks, it could be a sign of something more serious. Persistent hoarseness or a cough that doesn't go away should be evaluated by a healthcare professional. They may recommend a chest X-ray or other tests to determine the cause. Sign 5. Changes in bowel or bladder habits. Noticeable changes in bowel or bladder habits can also be a warning sign. For instance, prolonged diarrhea, constipation, or blood in your stool or urine should prompt a visit to your doctor. These changes can be symptoms of colorectal cancer or bladder cancer. It's important to note the frequency, consistency, and color of your stools and urine. Doctors sometimes see pencil-thin stools with colon cancer. You experience any of these changes and they last for more than a few days, make sure to discuss them with your doctor. Early detection of these symptoms can lead to earlier treatment and better outcomes. Sign 6. Unusual bleeding or discharge. Any unexplained bleeding or discharge, such as blood in the urine, stool, or from the vagina, should never be ignored. This could be an early sign of cancers such as colorectal, bladder, or cervical cancer. For instance, blood in the stool can be an indication of colon cancer, while blood in the urine can suggest bladder or kidney cancer. If you notice any unusual bleeding or discharge, don't wait. Schedule an appointment with your healthcare provider to get it checked out. Sign 7. Lumps or thickening. Keep an eye out for any lumps or thickening in the breast, testicles, or lymph nodes. While not all lumps are cancerous, it's always better to have them evaluated by a healthcare professional. Most men, 90%, with cancer of the testicle have a painless or uncomfortable lump on the testicle. Some men have an enlarged testicle. Regular self-examinations can help you detect any new lumps or changes early. It's important to be familiar with your body and recognize any abnormalities. If you discover a lump or thickening, especially if it's growing or changing, make an appointment with your doctor. Sign 8. Difficulty swallowing. Difficulty swallowing, or a feeling that food is stuck in your throat or chest, can be a symptom of throat or esophageal cancer. If this persists, make sure to see your doctor. This symptom can be subtle at first, but if it becomes persistent, it's important to get it evaluated. It could be caused by a growth in the esophagus that's making it hard to swallow. Persistent difficulty swallowing should not be ignored. Your doctor can perform an endoscopy or other tests to find the cause and recommend appropriate treatment. Sign 9. Persistent indigestion or nausea. Persistent indigestion or nausea can sometimes signal stomach cancer. If you're experiencing these symptoms regularly, it's important to get them checked out. Occasional indigestion or nausea is common, but persistent symptoms that don't respond to over-the-counter treatments could be a sign of a more serious condition. If you have ongoing indigestion or nausea, speak with your healthcare provider. Sign 10. Persistent pain. Lastly, persistent pain that doesn't have a clear cause and doesn't go away can be a symptom of many types of cancer. If you're experiencing ongoing pain, especially in your bones or other areas, seek medical advice. Cancer-related pain can be due to the tumor pressing on nerves, bones, or other organs. It's different from the usual aches and pains we experience and often doesn't respond to standard pain relief. Some brain tumors cause headaches that last for days and don't get better with treatment. If you have persistent, unexplained pain, make an appointment with your doctor. Early diagnosis and treatment can help manage the pain and address the underlying cause. Women tend to ignore early signs of ovarian cancer or think their symptoms are simply related to aging, weight gain or other less serious problems, says Amina Ahmed, MD, a gynecologic oncologist at Rush. Remember, these symptoms can also be caused by conditions other than cancer. However, it's always better to be safe and get any unusual changes in your body checked out by a healthcare professional. Early detection saves lives. Thanks for watching. If you found this video helpful, please give it a thumbs up and share it with your loved ones. Don't forget to subscribe to our channel and hit the bell icon for more health tips. Stay healthy, stay informed, and we'll see you next time.